Good afternoon. This is All India Radio. I am Valsa Williams and with me is Prashant Kumar Sinha with the Midday News. The headlines. 6 flights to land today, bringing back stranded Indians from abroad on third day of Vande Bharat mission. Health Ministry issues revised discharge policy for COVID-19 patients. Very mild and moderate patients can be discharged without test. Recovery rate from COVID-19 reaches 29.91%. Home Minister Amit Shah says not allowing the trains reaching West Bengal is injustice to migrant labourers. Drug Controller General of India gives approval for clinical trials of 2 drugs, phytopharmaceutical and favipiravir, for treatment of COVID-19. And in Chhattisgarh, 4 Maoists killed in encounter in Rajnandgaon district. Six flights will bring back stranded Indians from abroad on the third day of the Vande Bharat mission today. 5 of these are flying from Gulf countries, while 1 from Dhaka to Delhi has taken off. This is the second flight from Dhaka, which is carrying 129 passengers, including students, stranded tourists, medical cases, and people whose visa has expired. They were tested by medical teams as per the safety protocols issued by the Union government. Our Dubai correspondent reports that Vande Bharat mission has come as a ray of hope amongst the stranded Indians. Day 3 of the Vande Bharat mission will see nearly 850 Indians flying back to Lucknow, Hyderabad and Kochi from the various Gulf countries. From Sharjah, a special flight will carry more than 175 distressed Indians to Lucknow. Kuwait is repatriating 150 people to Hyderabad and another approximately 172 to Kochi, and Doha is sending back more than 175 Indians who are in distressed condition. All the Indian missions are giving priority to workers in distress, elderly people, urgent medical cases, pregnant women and others stranded in difficult situation. 3 more flights will land in India after midnight today. More such flights from several countries have been scheduled till next Friday. In Chennai, 2 Vande Bharat mission flights from Dubai landed early this morning with 359 evacuees. They were tested by medical teams and were quarantined as per the safety protocols issued by the Union government. More from our correspondent.
The incoming passengers were subjected to thermal screening and then nasal and throat swabs were taken to see if they have the SARS-CoV-2 infection. Those who preferred quarantine in hotels were accommodated at their own cost in 2-star hotels in Chennai, while others were taken to a prominent college on the city outskirts where COVID-19 care center has been established to quarantine such evacuees. Tonight, an Air India flight brings about 250 evacuees from Kuala Lumpur to Trichy. Jai Singh, AR News, Chennai.
3 flights carrying expatriates from Gulf regions will leave for Kochi in Kerala today, with nearly 600 passengers as part of the Vande Bharat mission. A report.
Flight from Muscat carrying around 220 passengers is scheduled to arrive in Kochi at 8:50 p.m. and flight from Kuwait with nearly 180 passengers will arrive in Kochi International Airport at 9:50 p.m. today. District administration has made all necessary arrangements for the detailed medical screening, disinfected special vehicles for the transfer of returnees to the quarantine centers, fully equipped COVID care centers, facilities for medical follow-up and strict surveillance of the returnees. Authorities informed that the condition of few passengers who were shifted to hospitals on showing symptom on arrival last day is stable. Meanwhile, the state capital Thiruvananthapuram is all set to welcome expatriates as the first flight to the city from Doha will arrive tomorrow. All arrangements are being done, including a thermal face detection camera has been set up in the airport to scan passengers as soon as they enter. Mayusha for AR News from Thiruvananthapuram.
Our Lucknow correspondent reports that the flight will reach around 8:50 this evening. State Civil Aviation Minister Nandgopal Gupta Nandi said the team of medical experts with PPE kits and other medical equipment will be there at the airport, and after screening, passengers will have the option to go to their native places by paid taxi and bus service and will be quarantined there. The passengers on the flight will also have the option of either being quarantined in Lucknow for 14 days in a government center or in hotels that will charge them a reasonable amount.
As part of Samudra Setu program under Vande Bharat mission, another ship of the Indian Navy will leave from Maldives for Kochi tomorrow. The first ship, INS Jal Ashwa, had left from Mali last evening carrying 698 passengers, including 19 pregnant women and 14 children. The ship is expected to reach Kochi tomorrow morning. The second ship, INS Magar, is scheduled to leave tomorrow from Mali carrying around 200 passengers. The Indian High Commission in Mali is busy finalizing the arrangements for tomorrow's evacuation, and the final list of passengers will be published this afternoon. The evacuation is part of the Indian government's program to evacuate Indians stranded abroad. The program, named Samudra Setu by the Indian Navy, entails to bring back around 2,000 Indians in 4 ships from Maldives. Both ships, INS Jal Ashwa and INS Magar, are expected to repatriate another group of Indians to Tuticorin next week, and preparations for this has also begun. Preference is being given to medical emergencies, stranded tourists, pregnancy cases and migrant workers suffering job losses for evacuation. Indian High Commissioner to Maldives, Sanjay Sudhir, had termed the exercise as the biggest of its kind from the neighbouring country and thanked the Maldives government for its assistance. The Health Ministry has issued revised discharge policy for COVID-19 patients. As per the new policy, very mild, and moderate patients can be discharged without COVID-19 test subject to clinical conditions. Very mild, and pre-symptomatic cases admitted to a COVID care facility will undergo regular temperature and pulse oximetry monitoring. The patient can be discharged after 10 days of symptom onset and no fever for 3 days. There will be no need for testing prior to discharge. The patient will be advised to follow the home isolation for further 7 days. If they develop symptoms of fever, cough or breathing difficulty again, they must contact the COVID Care Centre or the State Helpline or 1075. As per the revised policy, moderate cases will undergo monitoring of body temperature and oxygen saturation. If the fever resolves within 3 days and the patient maintains saturation above 95% for the next 4 days, the patient will be discharged after 10 days of symptom onset, provided there is no fever or breathlessness.
The Health and Family Welfare Ministry has said 17,847 patients have been cured so far, and the recovery rate from COVID-19 has reached 29.91%. During the last 24 hours, 95 deaths have been reported, taking the nationwide toll to 1,981. A total of 3,320 new confirmed cases of novel coronavirus have been reported in the country during the last 24 hours, taking the total number of cases to 59,662. The Indian Council of Medical Research, ICMR, has said that a total of 15,23,213 samples of COVID-19 have been tested by various government and private laboratories in the country so far. Yesterday, 85,425 tests were conducted. Meanwhile, ICMR is continuously scaling up its testing facilities for COVID-19 by giving approval to government and private laboratories.
Home Minister Amit Shah has told West Bengal Chief Minister Mamata Banerjee that her government not allowing trains reaching West Bengal is injustice to migrant labourers. In a letter to Banerjee, Mr. Shah said this will create further hardships for labourers. He said the centre has facilitated more than 2 lakh migrants to reach home. He said migrants from West Bengal are also eager to reach home, and the central government is facilitating, but it is not getting expected support from the state government. The West Bengal government has sent requisitions to the Railway Ministry for running 8 Shramik special trains to bring back stranded labourers. According to state government sources, around 30,000 migrant labourers will be brought back to West Bengal from Jalandhar, Bangalore, Vellore, Hyderabad and Chandigarh. These 8 Shramik specials will run for 3 days from today and will culminate at North Bengal and various parts of Jungle Mahal and Kolkata.
Union Minister for Food and Public Distribution Ram Vilas Paswan has said a massive exercise is underway to supply free food grains and pulses to about 80 crore people across the country under the Pradhan Mantri Garib Kalyan Anna Yojana PMGKAY. Mr. Paswan said the government is making efforts to ensure that food grains are readily available for distribution in all the states for meeting their requirements under the Yojana. Mr. Paswan said the Food Corporation of India has loaded a total number of 2,641 rakes carrying about 74 lakh metric tons of food grains, which is an all-time record during the lockdown period from the 24th of March till date.
रेल मार्ग के द्वारा कुल मिलाकर करीब 74 लाख मैट्रिक टन अनाज का उठाव लॉकडाउन के बाद में हम लोग कर चुके हैं और उसमें से जो रैक का इस्तेमाल किया गया है रेल रैक का वो 2,641 रेल रैक का इस्तेमाल किया गया है.
Diwan Thakur of Muzaffarpur in Bihar has received benefits under the PM Garib Kalyan Yojana. He said the scheme has provided much needed support during the COVID-19 outbreak.
मेरा नाम देवान ठाकुर है. मैं मुजफ्फरपुर जिला के रहने वाला हूँ. प्रधानमंत्री जी के ओर से हम लोग को जो गैस का है चाहे अति है खाद्यान्न अति है खाने पीने वाला चीज है वो सहायता मिला है. इसके लिए प्रधानमंत्री जी को बहुत बहुत धन्यवाद देता हूँ.
Health Minister Dr. Harshvardhan and Minister of State for Health Mr. Ashwini Kumar Chaubey today reviewed COVID-19 management in the 8 states of the Northeast through video conferencing. The Arunachal Pradesh government has decided to impose a cess of 25% on all alcoholic beverages, which will be effective from today. Chief Minister Pema Khandu in a social media post said that the decision has been taken to augment the state's own resources. It will help the state exchequer to generate a revenue of 70 crore rupees, which will be used in the combat against COVID-19. The Chief Minister said that the cess has been levied at retail prices and shall be payable before movement of goods from wholesale vends to retail outlets.
Arunachal Pradesh Home Minister Bamang Felix has said that Arunachal is one of the few states in the country to make institutional quarantine compulsory for those people returning to the state. He said RT-PCR test is mandatory for people coming back from other states. Mr. Felix said this during a press briefing at Itanagar today. He informed that the state government during a cabinet meeting on Friday has decided to convert the BPL colony at Lekhi as a state quarantine centre.
You are listening to the Midday News on All India Radio. A reminder of the headlines before we move on. 6 flights to land today bringing back stranded Indians from abroad on the 3rd day of Vande Bharat mission. Health Ministry issues revised discharge policy for COVID-19 patients. Very mild and moderate patients can be discharged without test. Recovery rate from COVID-19 reaches 29.91%. Home Minister Amit Shah says not allowing trains reaching West Bengal is injustice to migrant labourers. Drug Controller General of India gives approval for clinical trials of 2 drugs, phytopharmaceutical and favipiravir, for treatment of COVID-19. And in Chhattisgarh, 4 Maoists killed in encounter in Rajnandgaon district. For quick news updates round the clock, follow us on our Twitter handle at AIR News Alerts.
The Council for Scientific and Industrial Research, CSIR, has received approval for clinical trial of 2 drugs to treat COVID-19. The Drug Controller General of India has given approval for the clinical trials of the drugs, namely phytopharmaceutical and favipiravir. Speaking exclusively to AIR News, CSIR Director General Shekhar Mande said the drug trial will begin within a week. He also stated that CSIR has already been working with pharmaceutical companies for the solution to control COVID-19. Dr. Mande informed that favipiravir is a proven anti-influenza drug used in Japan, China and other countries, while phytopharmaceutical is a herbal medicine extracted from plants.
I think the 2 drugs that we are talking of, one is something called favipiravir and the other is a phytopharmaceutical based on a plant, so the ACQH. So they are the 2 that we have got approval from DCGI. So favipiravir is a general antiviral drug. It inhibits the RNA-dependent RNA polymerase, which means it inhibits the virus replication inside our body. When a virus makes large number of copies of itself in our body, that process is inhibited by this drug. It's already in use as an anti-influenza drug in some of the countries, and clinical trials are also going on in some other countries including China and Japan. So we thought that we should also quickly do limited clinical trials here. Since the drug is used already in other geographies, it's already known to be safe. So it comes under the category of repurposing. So we don't have to go through all the safety trials and all.
CSIR is leading the fight against COVID-19 using a multi-pronged approach and multiple models of engagement, Director General Dr. Shekhar Mande said, as the research into SARS-CoV-2 is in early days and the understanding is evolving each day. It is critical that we need to deploy all possible strategies to combat the virus.
On the direction from the Centre, Director of AIIMS New Delhi, Dr. Randeep Guleria, and Senior Medical Expert Dr. Manish Suneja reached Ahmedabad yesterday night to provide expert guidance to the medical teams. Following the rapid rise in the number of cases in Gujarat, the state government has asked the Centre to send experts to the state. A report.
Renowned pulmonologist Dr. Randeep Guleria and medicine expert Dr. Manish Suneja visited Ahmedabad Civil Hospital today morning. They provided expert guidance to the resident doctors on the treatment of COVID-19 patients. Later in the day, both the doctors will visit AMC-run SVP Hospital to give advice to doctors on COVID-19 management. Official sources said the doctors will address a press conference in the evening. The state has so far reported over 7,000 cases and 449 deaths due to COVID-19, out of which over 5,000 cases and 343 deaths have been reported from Ahmedabad alone. Aparna Khun, AR News, Ahmedabad.
In wake of the ongoing nationwide lockdown, the Himachal Pradesh government has urged various states and union territory administrations to make adequate plans and necessary arrangements for evacuation of stranded people of Himachal Pradesh. On the other hand, the state cabinet has decided to give its nod to increase the curfew relaxation to 7 hours from 5 hours. Meanwhile, active COVID-19 cases in the state has gone up to 9. A report.
Due to nationwide lockdown in view of COVID-19 pandemic, the state government is constantly making efforts to bring back their residents stuck in various parts of state and union territories. A letter in this regard has also been written to all the states and union territory administrations. So far, 9,177 stranded residents of state have registered for their evacuation. The state government will bear the expenses of sending the stranded people. Meanwhile, 7 new COVID-19 cases have been reported during the last 4 days, taking the total active cases to 9 in the state. More than 9,000 pupils have been tested for COVID-19 in the state so far. Sanjeev Sundaryal, AIR News, Shimla.
In Madhya Pradesh, the number of coronavirus cases in the state rose to 3,341. The state conducted 63,705 tests so far. The condition of 1,518 patients is stable, while that of 274 was serious. So far, 1,349 people have recovered from coronavirus infection, while 200 have died. Meanwhile, 365 Kashmiri students stranded in various parts of the state due to the lockdown have been sent home to their native places in 18 air-conditioned buses from Bhopal today. Official sources said another group of Kashmiri students will also leave from Indore to their home state. On the other hand, the state government is making every effort for the safe return of the workers.
Chief Minister Shivraj Singh Chauhan has again appealed to the workers of Madhya Pradesh stranded in other states not to worry. Their safe return to Madhya Pradesh would be ensured. He also requested that they should have patience, should not walk and give their details by contacting the control room. The state government is committed to ensuring their safe return. So far, 1,25,000 workers of Madhya Pradesh stranded in different states have been brought back to the state. Special trains have been arranged for this purpose. Of these, 11 trains have already come back carrying the workers. Another 10 trains would come today and tomorrow, and 40 more trains are also ready, which will bring the workers back to Madhya Pradesh as per schedule. Sanjeev Sharma, AIR News, Bhopal.
In Bihar, the number of cured patients has gone up to 300 with the discharge of 33 patients from hospitals today. 303 are undergoing treatment in different hospitals. The rate of cured patients has gone up to 52%. The number of positive cases in the state is 580. Maximum 102 are positive cases from Munger, followed by 58 in Buxar, 57 in Rohtash. 5 patients died due to corona. Door-to-door survey is underway to detect positive cases. Over 10 crore 40 lakh people have been surveyed. About 4,000 suspected cases have been detected. 82,554 stranded migrant workers, students and others have so far reached the state from different parts of the country by 70 special trains so far.
Karnataka has reported 36 new COVID-19 positive cases today morning. Bengaluru Urban has 12 new confirmed cases, Davangere 6, Uttara Kannada 7, Dakshin Kannada, Chitradurg and Bidar 3 each, Vijayapura and Tumkur 1 each. Medical Education Minister in the state, Dr. K. Sudhakar, has tweeted that the state has conducted over 1 lakh tests for coronavirus. More from our correspondent.
Dr. Sudhakar has also tweeted that the state will have 60 labs to test the virus by this month end and can conduct 10,000 tests per day. The Brihad Bengaluru Mahanagara Palike has launched an awareness campaign to educate citizens of Bengaluru for self-monitoring of pandemic symptoms, naming the post-lockdown management of COVID-19 as the Pranavayu program. The city corporation is creating awareness of ways to test influenza-like illness by using finger pulse oximeter, a device that displays oxygen saturation in the blood and heart rate of the patients. A drop in oxygen saturation below 90% is a clear sign on developing severe acute respiratory illness that is fatal for COVID-19 patients. Sudhindra, AIR News, Bengaluru.
Maharashtra is approaching 20,000 mark in the COVID-19 cases and has seen 4-digit rise in the cases for past 3 days. The state's tally has reached 19,063 with the addition of 1,089 new cases. The death toll of the state has risen to 731 with 37 deaths occurring yesterday. Mumbai's tally has reached 11,967 with 748 new cases reported yesterday. In the backdrop of the rising trend of COVID-19, the Maharashtra government is focusing on strict action against those who failed in handling the situation and showed negligence in the healthcare administration. More from our correspondent.
After the reformation in Mumbai's civic administration yesterday, Maharashtra government has initiated the process of reform in the administration of prominent hospitals. Chief Minister Uddhav Thackeray had already warned of strict actions against the lethargic approach in the hospitals. After a video went viral, in which a patient was seen receiving treatment next to a bed with a dead body on it. In the backdrop of his warning, Acting Dean of Sion Hospital, Dr. Pramod Ingle, was sent to his old department and Dr. Ramesh Bharmal was appointed as the Dean of the Sion Hospital. Similarly, Dr. Mohan Joshi was appointed as the Dean of BYL Nair Hospital as the post was lying vacant. The Dean and Superintendent of Chhatrapati Shivaji Hospital in the neighboring Thane district were also transferred due to negligence in handling the COVID patients' dead bodies. Meanwhile, the newly appointed Municipal Commissioner of Mumbai, Iqbal Singh Chahal, has assumed his charge and visited Nair Hospital in Mumbai today. Shailesh Patil, AR News, Mumbai.
Technology is being used to reduce the risk factor and help the health personnel engaged in COVID-19 treatment. An advanced Midday rover robot will be in service of the district hospital of Chandrapur in Maharashtra from today. The robot, manufactured by Tata Technology, was handed over to the district health machinery by District Collector Kunal Khemnar yesterday. The battery-operated robot can carry various objects like food packets, medicines and other useful instruments up to 30 kilograms and can be operated from a distance of 10 meters. In an effort to guard against fake news being circulated on various platforms, we bring you our segment on fact-checking and mythbusters. The government has rejected a claim made in WhatsApp forwards that there will be a military lockdown in Mumbai for 10 days starting today. In a tweet, Press Information Bureau described it as fake message. It said no army or navy personnel are being deployed for maintaining law and order in the city.
The News Services Division of All India Radio, in its bilingual live phone-in program today, will bring listeners a special discussion program on COVID-19. Dr. Naresh Gupta, senior physician, will participate in the discussion. Listeners can ask questions to the expert on toll-free telephone number 1-800-115-767. One can also ask questions on telephone number 011-2331-4444 and also post queries on our Twitter handle at AIR News Alerts by hashtag AskAIR. This can be heard tonight on the FM Gold channel and additional frequencies from 9:25 p.m. onwards. This program will also be available on our website newsonair.com and on our YouTube channel News on AIR Official. Listeners can also follow us on the News on AIR app for updates. In our series Expert Speak on All India Radio, we bring you views of leading medical experts on COVID-19. Talking to AIR News, President of Public Health Foundation of India, Dr. K. Srinath Reddy, stressed the need to maintain social distancing to check the spread of COVID-19 in the country.
Social distancing is a very effective measure for preventing the transmission of the virus from an infected person to a non-infected person. So we must maintain a distance of at least 2 meters between ourselves and another person so that we can prevent this virus from traveling between two people. We must also ensure that this happens both outside in the market but also in offices where we have to work together with other people.
Director AIMS Dr. Randeep Guleria advised people to follow the social distancing and hand hygiene norms to check the spread of COVID-19 infection.
Currently, we have to be aggressive in social distancing, hand washing and quarantine, and this is more and more important in the hotspot. I would advise everyone, especially those who are in the hotspots, to really sincerely, as citizens in a patriotic manner, observe this lockdown, because if we observe this lockdown in a sincere manner, we will be able to break the chain of spread and we will be able to bring down cases and be able to prevent deaths and conquer corona in India.
Prominent persons have appealed to people to follow the lockdown guidelines as announced by the government. Veteran cricketer Sunil Gavaskar urged people to stay home to break the chain of COVID-19.
Please maintain personal hygiene, avoid gathering in places, because that is where the virus can spread and you might also catch it unknown to you. Please avoid unnecessary travel. Believe me, that's the hardest thing for me myself, because I am on a plane every third or fourth day. So please try and avoid unnecessary travel.
In Chhattisgarh, a police sub-inspector lost his life in an encounter with Maoists. 4 Maoists were also killed in this gun battle. A report from our Raipur correspondent.
Security forces received a specific input that large number of Maoists are present in the Manpur area of Rajnandgaon district. On the basis of this intelligence input, a team of district police force launched a massive search operation in the forest of Manpur late last evening. Maoists ambushed the police team near Pardhoni village and opened indiscriminate fire. Police jawans retaliated the fire. In the exchange of fire, the in charge of Madanwada police station, Shyam Kishore Sharma, lost his life, while 4 Maoists also killed in this encounter. Bodies of the killed Maoists, along with 1 AK-47 rifle, 1 SLR weapon and 2 rifles recovered from the spot. With Mithilesh Devangan from Rajnandgaon, this is Vikalp Shukla for AIR News, Raipur.
India's national broadcasters Doordarshan and All India Radio have assumed focus on comprehensive weather coverage from across the entire territory of the country. These weather reports cover every small detail from every nook and corner of the country, while highlighting extreme weather conditions, temperatures of various places from Kashmir to Kanyakumari, Gilgit to Guwahati, Baltistan to Port Blair. We have this report on today's weather.
The maximum temperature in the national capital will be 41 degrees Celsius during the day, while the minimum temperature will settle at 25 degrees Celsius. Delhi will witness a partially cloudy sky with possibility of development of thunder lightning. Mumbai will see a clear sky with maximum temperature settling at 34 degrees Celsius. Minimum temperature in the city will be 26 degrees Celsius. In Kolkata, maximum temperature will be 35 degrees Celsius. Minimum temperature is expected to be 26 degrees Celsius. City will witness a partially cloudy sky with a possibility of moderate rain or thunderstorm. In South, Chennai will experience a partially cloudy sky today with the maximum temperature settling at 37 degrees Celsius, while the minimum temperature will be 30 degrees Celsius. In the Union Territory of Jammu and Kashmir, Jammu is experiencing a partially cloudy sky with maximum temperature of 35 degrees Celsius. Minimum temperature will settle at 25 degrees Celsius. Srinagar is witnessing partially cloudy sky today. There is a possibility of rain or thunderstorm or dust storm. Maximum temperature will be 24 degrees Celsius and minimum temperature will be 14 degrees Celsius. Gilgit will experience a partially cloudy sky. Maximum temperature will hover at 30 degrees Celsius and minimum temperature will settle at 20 degrees Celsius. Muzaffarabad will also experience a partially cloudy sky throughout the day today. Maximum temperature will be 22 degrees Celsius and minimum temperature is expected to settle at 13 degrees Celsius today. Diksha Saxena, News Desk.
And now, before we end the bulletin, the headlines once again. 6 flights to land today, bringing back stranded Indians from abroad on third day of Vande Bharat mission. Health Ministry issues revised discharge policy for COVID-19 patients. Very mild and moderate patients can be discharged without test. Recovery rate from COVID-19 reaches 29.91%. Home Minister Amit Shah says not allowing trains reaching West Bengal is injustice to migrant labourers. Drug Controller General of India gives approval for clinical trials of 2 drugs, phytopharmaceutical and favipiravir, for treatment of COVID-19. And with that we end the midday news.